Getting turned around on the way to a store you have driven to for years is not something to shrug off. Brain changes tied to dementia can begin years before a doctor ever makes a formal diagnosis. And the Alzheimer's Association estimates that by 2026, 7.4 million Americans aged 65 and older will be living with clinical Alzheimer's dementia. They also estimate that roughly 4.2 million older Americans may have mild cognitive impairment due to Alzheimer's disease. The part many families miss is this. The earliest warning signs often do not begin with forgetting a grandchild's name. They can show up as poorer navigation, a weaker sense of smell, broken sleep, or quietly pulling away from people and routines you used to enjoy. Dementia is not one single disease. It is a group of symptoms caused by diseases that damage the brain over time. Alzheimer's is the most common cause worldwide, but vascular dementia and Lewy body dementia matter too. What makes this so personal for people in their late 50s, 60s, and early 70s is that this is often the window when subtle changes first appear, but it is also the window when action still matters. This is not just about memory. It is about driving safely, managing medications, following a recipe, paying bills, keeping your place in a conversation, and staying independent long enough to enjoy your life, your spouse, your home, and your grandchildren. Some of the earliest signs are easy to dismiss because they do not look dramatic. One is worsening navigation. A person may remember names just fine but start feeling disoriented in familiar places. That matters because spatial navigation depends on brain areas like the hippocampus and entorhinal cortex, which can be affected early in Alzheimer's disease. Another is reduced sense of smell. Trouble identifying odors has been linked with later cognitive decline in some older adults, though it is not specific to dementia, because smell loss can also come from aging, sinus issues, smoking history, viral illness, or head injury. Sleep changes are another major clue. Frequent nighttime waking, severe daytime sleepiness, untreated sleep apnea, or acting out dreams during sleep should not be ignored. Dream enactment is especially important because it can be an early clue in Lewy body disease or related disorders years before diagnosis. Then there is the classic pattern. People know better. Subtle, short-term memory trouble. Repeating questions, forgetting recent conversations, misplacing things more often, or losing the thread in the middle of a task can all be early warning signs. Word-finding trouble also matters. If someone starts saying that thing instead of the actual word, pauses more often, or has trouble naming familiar objects, pay attention to the pattern. The signs are not always cognitive in the way people expect. Apathy and social withdrawal can come early. Some people slowly stop joining conversations, hobbies, church groups, or family events. Mood and personality changes can show up too, including irritability, anxiety, suspicion, or seeming less warm and less like themselves. Poor judgment with complex tasks is another clue, such as trouble tracking bills, travel plans, medicines, or multi-step errands. Some people also notice something is off before testing shows much. That is called subjective cognitive decline, and a meta-analysis found it was associated with about double the risk of later cognitive impairment, or dementia. Sometimes family notices first. Missed appointments, confusion in noisy restaurants, or a spouse saying, "Your memory is not what it used to be." One sign alone is not proof of dementia, but a pattern that is growing over months deserves attention. Different dementias have different biology, but the message is similar. In Alzheimer's disease, abnormal proteins like amyloid and tau damage brain cells and their connections. In vascular dementia, reduced blood flow and small vessel damage injure the brain over time. In Lewy body dementia, a different protein affects thinking, movement, sleep, and sometimes perception. The encouraging part is that not everything is fixed in stone. The 2024 Lancet Commission estimated that about 45% of dementia cases worldwide may be linked to 14 potentially modifiable risk factors across life, including hearing loss, high LDL cholesterol, depression, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol, social isolation, air pollution, and vision loss. That does not mean any one person can guarantee prevention. It does mean there are real levers you can still pull. This is where the story changes from fear to agency. A food-first, Mediterranean-style or mind-style eating pattern has some of the best support we have. An NIH summary of a 2024 analysis found that people with the highest mind-diet adherence had a 4% lower risk of cognitive impairment than those with the lowest adherence. Other 2024 meta-analyses found Mediterranean diet adherence was associated with about an 11 to 30% lower risk of age-related cognitive disorders, depending on the outcome studied. These are associations, not guarantees, but the direction is consistent. This way of eating likely helps by improving blood flow to the brain, reducing inflammation and oxidative stress, and supporting insulin sensitivity in brain cell membranes. Start with extra virgin olive oil. Use it as your main added fat each day instead of relying on refined oils or heavily processed spreads. A randomized trial in people with mild cognitive impairment found that extra virgin olive oil improved markers related to the blood-brain barrier and some clinical measures. It is not a miracle cure, but it is a strong everyday swap. Think simple. Drizzle it on vegetables, beans, salads, or cooked fish. Then bring in green leafy vegetables most days. Spinach, kale, collards, Swiss chard, and romaine are the big ones. In the Rush cohort data often cited in brain aging research, higher leafy green intake was linked with slower cognitive decline, with the higher intake group averaging around 1.3 servings a day. These greens provide folate, vitamin K, lutein, nitrates, and other compounds that support blood flow and brain health. You do not need perfection here. A serving most days is a practical target. Blueberries are another smart choice. In one randomized trial, 24 grams a day of freeze-dried blueberry powder, roughly equal to 1 cup of fresh blueberries, improved some executive function measures over 90 days in adults ages 60 to 75. Another trial found wild blueberry intake over 6 months improved speed of processing in older adults with mild cognitive decline. The likely helpers are anthocyanins and other polyphenols, which may reduce oxidative stress and support vascular function and cell signaling. A cup of blueberries in yogurt or oatmeal is an easy place to start. Fish matters too, especially salmon, sardines, trout, herring, and mackerel. A reasonable food-first target is fish about 2 times a week. These provide DHA and EPA omega-3 fats that support brain cell membranes and may help reduce inflammation. The research is more convincing for eating fish as part of an overall healthy pattern than for assuming fish oil pills will fix memory. So think dinner plate before supplement shelf. A small handful of nuts each day is another helpful habit. Walnuts, almonds, pistachios, and mixed tree nuts bring healthy fats, vitamin E, magnesium, and polyphenols. The direct evidence for specific nuts preventing dementia is not as strong as the evidence for the overall Mediterranean or mind pattern, but they fit the pattern well and support vascular health. Beans and lentils belong here too. Chickpeas, black beans, lentils, and cannellini beans help steady blood sugar, add fiber, and support heart and brain health together. Since diabetes is a dementia risk factor, keeping blood sugar steadier is not a small thing. It also helps to trade refined grains for whole grains more often. Choose steel-cut oats, old-fashioned oats, quinoa, barley, or brown rice in place of sugary cereals, white bread, and other fast-burning starches. If you tolerate dairy, plain yogurt or fermented dairy with minimal added sugar can also fit, though the direct dementia evidence is still preliminary. And just as important as what to add is what to cut back. Higher intake of ultra-processed foods has been associated with higher dementia risk in observational research. These foods tend to push blood sugar, inflammation, weight gain, and vascular strain in the wrong direction. Food is powerful, but do not ignore the non-food clues. Hearing loss is one of the strongest modifiable associations with dementia risk. Sleep apnea matters. Loneliness matters. If you or your spouse are acting out dreams, getting lost, missing bills, or medicines, becoming unusually withdrawn, or changing in ways both of you can see, get checked. Especially seek medical evaluation if symptoms interfere with driving, finances, cooking appointments, or if they come with falls, hallucinations, gait changes, major behavior change, or start suddenly. Some causes of thinking changes are treatable, and early evaluation gives you more options, not fewer. What matters most is not panic. It is pattern recognition and action. This week, pick one meal and make it more brain-friendly. Olive oil instead of butter. Leafy greens on the plate. Beans or fish for protein. Berries for dessert. And fewer ultra-processed snacks in the house. Then write down any changes you or your family have noticed, especially with navigation, sleep, memory, mood, or daily tasks. The goal is not to label yourself. The goal is to protect your independence, while there is still time to do something meaningful about it.